Hi, I'm Dr. Darren Farnesi. I practice anti-aging, functional, and regenerative medicine in San Diego, California. I also do some cosmetic dermatology as well. I think one of the most fascinating things for me as a doctor now is that the kind of patients that come to see me are already a little bit interested in their health. And so if I have a conversation with them about what they're eating, and I really want to know what they're eating. I want to know what they're actually eating for breakfast. Not, oh, I eat high carb and that's it. Yeah, I want to know everything. I want to know what they're dreaming about at night. I want to know how they sleep and the quality of their sleep. I want to know how many sugary drinks they're drinking and alcohol and so many things. I mean, so many of the baby boomers are of the cocktail generation, 2 or 3 cocktails a night, and they don't realize what that's doing to all their goals. But the advantage that I have is that they seek me out now as someone who's going to help them transform their lives from a functional standpoint. So after I spend an hour on their first visit going through their entire medical history and exercise history and diet history and sleep history and just everything, plus a thorough physical exam, I get an attitude from them that's open to the idea of lifestyle change. I don't think you can do any of this successfully without pulling all those parts together. I like the term a symphony. I really resonate with that. I used to play the violin when I was younger, and when you're in an orchestra and there's one instrument playing wrong, the whole musical piece sounds terrible, even though everybody else is playing right. And so pulling all that together, I think, is the art of what we do, backed up by science, of course. One of the foundations that seems to crumble as we age is our hormonal symphony. So in a program, in an anti-aging program, probably the core of it is optimizing and balancing all the hormones. And we do that, of course, only through bioidentical hormones. We don't use any man-made or space alien molecules in practice. And so usually the initial visit starts with hormone testing, and a full hormone panel is often missed by regular primary care doctors, which I used to be. A lot of doctors are out there giving testosterone to men, and they're not checking estrogen or estrogen metabolites or DHEA or thyroid or adrenal glands. The adrenal glands are so important, and adrenal fatigue, I think, is the diagnosis of this decade. I mean, there are so many, even young people, who are just stressed out. So yes, that's typically what we do, is we start with hormones and we balance and optimize those. We use blood testing mainly. Saliva testing for adrenal hormones is probably the gold standard. And I do urine metabolite testing at least once a year on patients, because I do believe that there's quite a bit of evidence that you want to have the right ratios of metabolites. You want to make sure that your body is detoxifying the hormones correctly. Then you need to address nutrition, and we do some very in-depth nutritional testing. Gut health is just the most amazing frontier. I love quoting the statistic that we actually have more DNA in the bacteria in our gut than we do in our whole body. There's more cells of bacteria in our gut than there are cells in our body. It's really amazing. They're just much smaller. But there's this whole world. There's different layers and spaces, and every one of us has altered gut flora. If you've ever drank city water, taken an antibiotic, used fluoride toothpaste, it's all altered. And that affects your hormones, and nutrition is just the cornerstone. So you've got to do nutrition, you've got to do exercise, you've got to address sleep and quality of sleep, you've got to balance hormones and reduce stress. But I think the testing for bioidentical hormones and optimizing them to individualize that care is the art of this. The things I mainly do are the non-invasive or low-invasive type procedures: fillers, Botox, lasers, and light-based therapies for aging, age-related fat volume loss, skin tightening, and skin rejuvenation, and prevention, of course. Most people come in to the anti-aging practice and, oh, well, I'll spend money on this, but I don't really want to spend money on these expensive fillers or Botox or whatever. But then they start feeling better, and they want to look better too. And it's very interesting. And I am a bad salesman. I don't really remember to tell them about that stuff a lot. I'm too busy focusing on their hormones and their nutrition, and they'll start bringing it up. They're like, hey, I noticed this thing in your front office about Botox. Do you do that? And I'm like, yeah, I do that. Of course I do that. I love doing that. so it's kind of funny. So for more information, check out my website, www.manageyourage.com. It's all run together, manageyourage.com, and we look forward to hearing from you.